routine.
Exactly. Mike has this question, interesting. I have a bad back and I was told that I would benefit from a spinal fusion, but nobody wants to operate on me because of my weight. What should I do?
I think that actually, again, this is an interesting question from my point of view, because one of the areas of expertise that I developed over the years is to access the spine from the front. I've been working with spine surgeons for many years across the city, and actually I encountered multiple times in the past these circumstances. For the last several years, when I started doing weight loss surgery, then I have actually a solution, and we have patients like this. We discuss about, and again, because I get involved with the anterior axis of the spine, I discuss with the spine surgeon how critical it is to do the surgery nowadays, and many times it's not actually quite critical to do it right away. So we offer to these patients the chance of trying to do weight loss surgery. And of course we enroll in the program. As Stacy mentioned, it's very important for them to be prepared properly, to have realistic expectations, to have the commitment for all these things, because actually they come to the doctor with a back pain and they talk about weight loss surgery, which is a completely different philosophy. But if they are ready, if they have all these criteria fulfilled, and if they have enough emotional support and committed for these major life changes, then I offer to these patients weight loss surgery. And actually some of them, they didn't even need back surgery after this.
That was kind of my thought. I feel like
not all of them.
By eliminating the obesity problem, you can eliminate some of the other problems that were a result of the obesity.
Correct.
Absolutely
Correct. Not always.
No.
But many times, yes.
Sure. Les wants to know, are there any differences with the success process and or recovery within regards to male or female? Differences?
I think it depends a little bit on the procedure that they choose, and very much on with the expectations. There are certainly different expectations in society between women and men and what they're expected to eat when they're out. Men do very, very well with their weight loss early on. It's a little bit easier for men to lose weight. We're often a little bit jealous of that.
Yes, we are. 11 pounds a week, sometimes it's crazy.
Exactly. And they lose their weight very, very quickly. They lose their weight very, very readily. But it's also a little bit difficult for them, I've found, to adjust to a very restrictive diet, because it's something that society doesn't really expect of them. You know, the women are the ones that have to eat the salads and the very, very careful
The guys
portions.
get together and, you know, how many ribs can you take down with beers and everything else? So you're right. It's
socially,
very
sometimes it's a little bit difficult for them to get used to that. So they tend to do very, very well early, and then we have to sometimes rein them in a little bit later on. The women tend to do very, very well from a long-term standpoint once they get adjusted to their sort of restrictions, what they can and can't do, what they're comfortable with.
I have a question. I have heard.
Yes.
You want to
I'm
finish?
sorry.
Go ahead.
I want just to add to this that what I've noticed multiple times, and not to create any kind of a discrimination whatsoever, but actually women remain, and they have been always, kind of the center of the family in some regard. The maternal component of them makes them really, again, I don't want to say that men are not important, but women really are very, very important, very critical. And then once a woman loses weight, and she creates around her that type of environment, and is much stronger, much more impact than the rest of the family. And from that point of view, I think that I would tend to agree with Stacy that they have a little bit of a better chance in the long run once they engage into the process.
I have heard some studies and read some articles that sometimes when you have weight loss surgery, you lose the weight, you try to modify the eating, but it was an addiction in some ways, and you turn to something else, perhaps smoking, or now you're drinking. Does that happen?
It absolutely does happen. And actually, where I trained, we had a center of addiction transfer, and we actually did a lot of talking about this and a lot of research on this. And people do have some very serious addiction transfers that you have to be very careful of. Shopping is one that seems very minor, but we're talking about people who maybe haven't been able to shop at the places that they might like, and now they are able to, which seems like a good thing. But if it becomes any behavior that becomes uncontrollable financially, becomes a problem. So we've certainly seen addictions of that nature. We've seen gambling addictions. We've seen some people return to smoking behaviors, some drinking behaviors, and some, unfortunately, some social disorders, some promiscuity that wasn't available to them perhaps before and is now. So yeah, you have to be very, very careful.
On the other hand, it's not very frequent, thank God.
No.
But yes, these things do occur occasionally. So that is the part of counseling before, but mostly after the surgery. And I don't know how Stacy feels about this, but it has been my experience that as much as we try to educate and prepare them before surgery, a lot of education actually is necessary after the surgery, because it's one to talk about what's going to happen, and one is the thing to happen per se. So all these challenges do occur sometimes after surgery, and you have to be aware and to recognize this and to kind of step forward and help people.
That's right.
Specifically ask them about these things, and if we see them, just offer the emotional and psychological counsel that is necessary.
Sure, this is not just physical as people think. It is very, very much mental and emotional.
It is true.
A couple of questions quickly because we only have a few minutes left, but Annie wants to know, can the surgery be reversed?
Absolutely. And it depends, again, on which surgery that you choose. The lap band is, we don't like to say easily reversible, because I think that gives people a way out a little bit. And this is a huge commitment, obviously, but it is easy to remove technically.
Right, and obviously if you're cutting in other ways, you're not going to do so much reversal on some of
Right,
those.
yeah.
Correct. And probably the most irreversible, of course, is the sleeve gastrectomy, because you really removed some of the stomach. It's tough to put it back.
Yeah, exactly.
Yeah, absolutely.
Yeah.
A
No
gastric
turning back.
bypass certainly is reversible. It's difficult. It's not an easy thing, and we're not going to give you your full anatomy back. It's technically reversible, but because we've altered the anatomy, we can't put it quite back together, but functionally enough. We would only do that in a very extreme circumstance, obviously.
Absolutely.
Luke wants to know, what are the side effects of this kind of surgery? And I would add to that risks. I mean, there's a whole long list I've seen. There's vomiting, there's what they call dumping syndrome, nutritional deficiencies, complications potentially, gallstones. All of those things can happen, correct?
That is true. But on the other hand, I think that when we talk about risk and safety, we have to look a little bit in perspective. If you look at what we call morbidities, possible complications that do occur after weight loss surgery, and if you compare them with other major type of surgery, at least I'm very grateful to God, and I've been fortunate to say that in our program we had less morbidities than after hip replacement or knee replacement surgery. It's almost the same type of rate of complications than gallbladder removal. This type of other type of inconveniences and could lead to complication if you don't watch patients thoroughly. If somebody has a lot of vomiting and they don't follow up in the program properly, and they don't replace the nutrition elements, and they lose a lot of vitamins and so on. One of the very common, actually known, is somebody who vomits after the surgery and they don't really pay attention, and they are not follow up thoroughly, and then suddenly you realize a major vitamin B1 deficiency with a permanent neurological deficiency. So the same thing. Surgery is a tool. You have to be careful before surgery, but mostly after the surgery. And actually we have